Hello, today we're going to do cardiac tamponade for step 2 CK, step 3 and CCS. Before learning about the cardiac tamponade, let's learn about the pericardium. Pericardium is a double-layered fibroelastic sac covering the heart. It has a two-layer. The outermost layer is a fibrous and the innermost layer is called serous pericardium. The fibrous pericardium is most superficial layer which is made up of dense and loose connective tissue. The serous pericardium consists of two layers: parietal pericardium, which is fused with the fibrous pericardium, and the visceral pericardium, which is also called the epicardium. The space between the parietal and the visceral pericardium is called the pericardial cavity. Let's check the picture. Let's go from inside to outside. The first is the endocardium, then myocardium, then the visceral pericardium, then comes the parietal pericardium and the fibrous layer. The gap between the visceral pericardium and the parietal pericardium is called the pericardial cavity. The pericardial sac or the cavity contains serous fluid of around 15 to 50 ml. It can hold up to or more than 2 liters if the effusion increases gradually. If it is a sudden rapid effusion, even 100 to 200 ml can cause a significant cardiac compression. This is very important here. The cause for the cardiac tamponade are chest trauma, myocardial rupture after the myocardial infarction that usually happen from first day to 3 weeks, mostly on third to the fifth day, pericarditis, cardiac surgery, rarely a retrograde aortic dissection, uremia, and the cancer. The patient going to present with shortness of breath, lightheadedness, cough, or loss of consciousness. Physical examination. The raised JBP, decrease in blood pressure, muffled or distant heart sound. The raised JBP, decrease in blood pressure, and muffled or distant heart sound are called a back stride. It is a very important clinical feature to diagnose a cardiac tamponade. Also, a pulsus paradoxus, which is a decrease in systolic blood pressure of more than 10 mmHg during the inspiration. Normally, during the inspiration, there will be a decrease in interthoracic pressure, which increases the venous return to the right atrium, which decreases the compliance of the left atrium because they share a common septum. It decreases the preload and hence decreases in cardiac output. Normally, systolic blood pressure slightly decreases during the inspiration. If it decreases more than a 10 mmHg, we call that a pulsus paradoxus. Pulsus paradoxus can also be seen on constrictive pericarditis and other respiratory diseases like asthma. To diagnose, we do echo, will show a pericardial effusion, diastolic collapse of the right atrium and the ventricle. EKG will show electrical alterance. Chest X-ray will show a bottle-shaped heart. Right heart catheterization will show equalization of all pressure in heart during the diastole. Please remember, in a patient following a heart surgery, monitor chest drainage. If the drainage volume drops off and decrease in blood pressure, this can suggest a cardiac tamponade due to a tube clogging. This is very important here. Now let's check for the ECG. ECG is showing an electrical alterance, which is alteration of amplitude or axis between a beat. You can clearly see the QRS changing per beat. This is a 4-chamber echo, which is clearly showing a pericardial effusion here. The X-ray, which is showing a bottle-shaped heart. Prompt diagnosis and treatment is key to survival. If the clinical feature point towards the cardiac tamponade, go ahead and do pericardiocentesis. A prompt diagnosis using fast and treatment can be life-saving in traumatic acute cardiac tamponade. Pericardiotomy, PI or thoracotomy, is mandatory in acute traumatic cardiac tamponade. In case of ineffective drainage due to clot formation within the pericardial space. This is very important here. Patient in asystole or with a downtime of greater than 30 minutes should not undergo thoracotomy. Please remember this. The standard location for pericardiocentesis is the infrasternal angle, also called the subxiphoid approach. The another location is through the left fifth and sixth intercostal space, also called a paraesternal approach. The left paraesternal approach begins 3 to 5 cm left of the sternum to avoid the left internal mammary artery in the fifth intercostal. Procedure and complication. Insert a needle between xiphisternum and left costal margin. Direct towards the left shoulder at an angle of 40 degrees to the skin. Continue aspiration as needle approaches right ventricle. Once the pericardial fluid is aspirated, now insert a cannula into the pericardial space and attach a three-way tap. Complications are mostly myocardial perfusion, bleeding, pneumothorax, arrhythmia, the rapid drainage of pericardial fluid leading to excess left ventricular preload causing a pulmonary edema. This is very important here. Alright folks, all other slides from here are going to be for the stage 3 CCS. After a physical examination, click the order button, type IBSS, normal line, pulse oximetry, monitor cardiac and blood pressure. Remember, for the traumatic patient and in shock, do fast and order a pericardiocentesis here. If the patient is stable, order EKG, echo, and the chest X-ray. Forward the clock. ECG will show electrical alterance. Echo will show the pericardial effusion. Now order conscious surgery, pericardiocentesis, pericardial fluid analysis. Admit the patient and order bed rest, pneumatic compression, output for the urine, sound gauge catheter, or the basic investigation like CBC, BMP, PT, PTT, TSS, and also do a cardiac consult. Forward the clock and case will end. On the 2-minute screen, repeat the echo, counsel patient, no smoking, no alcohol, no illegal drugs if he is doing so, weight loss if he is obviously, vaccination and preventive procedure if it is due. Click the later date and you can do after a week or a month. Alright folks, that's going to be it for the step 2 CK, step 3 and CCS. Most asked question about the cardiac tamponade is from the physical examination. Remember the back tribe, that's rest JVP, decreasing blood pressure, a muffled or distant heart sound. Also remember about the pulsus paradoxus. Alright, that's going to be it. Thank you very much.